My name is Heath Dorian. I'm the program director for the General Surgery Residency here at Mercy Health St. Elizabeth Youngstown Hospital. I'm a proud graduate of this program and an Air Force veteran. The main mission of our program is to train excellent surgeons who will improve the health and well-being of the communities by providing patient-centered, generally compassionate, highly knowledgeable, and technically superior surgical care. Our residents benefit from spending time at other clinical sites that are affiliated with our program. Our sister hospitals, St. Elizabeth Boardman and St. Joseph Warren, rotate several residents each block. We also send PGY3 residents to Akron Children's Hospital for a pediatric surgery and burn experience, and to university hospitals in Cleveland for a transplant surgery experience.
What I'm so proud of about our surgical residency is the individualized training our surgical residents receive. We are a small residency by some standards. However, that allows us to give our residents an incredible breadth of clinical experience, especially in the operating room, and also individualized advising, coaching, and mentorship.
St. Elizabeth's Hospital offers the full complement of surgical services with just about every subspecialty represented. Our residents have ample opportunities to work in these subspecialties as we have no postgraduate fellowship program.
Our robotics program started back in 2013 with the residents being involved with the residency curriculum. I took part in designing it. Residents are involved at all three hospitals as we have unprecedented access to robotics here. All three hospitals have robots. We have 2 robots at 2 of the hospitals, and then here at the main campus we have a robot with a teaching pack and a teaching console. The residents immediately get access as interns to modules. They also start to progress through bedside cases, and then by the time they're mid-levels, they're already getting time on the console.
There are only 2 other surgical residencies here, ENT and orthopedics. So our residents see a spectrum of pelvic surgery, urology, trauma, critical care that is not available in larger academic centers. There are also no fellowships here, so our residents do all the cases.
Starting out when I was a resident, laparoscopy, especially at a level 1 trauma center, not maybe the first thing you were exposed to as a low-level resident. Being that we've advanced the minimally invasive and advanced laparoscopy portion of this residency over the last 10 years, I would say that the way this prepares residents leaving our program to participate in any aspect of general surgery and more independently be able to handle very, very complex disease in a minimally invasive, laparoscopic, and robotic fashion.
Each resident has an advisor assigned and also picks a mentor. And between the advice that those residents receive with those individuals and also what they receive from our clinical competency committee, we feel we can really individualize our recommendations to each resident. But our mission is that our surgeons leave here and are able to go out in the world and be competent and confident surgeons, whether that's in a rural setting, a mission setting, or an urban setting like we're here at St. Elizabeth.
For being a level 1 trauma center, we do see the full gamut of patients, from critically injured to the walking wounded. We see pediatric patients all the way to 100-year-olds, and not only just with our trauma services, but we also see that through the full gamut of general surgery as well.
I remember on my interview day seeing that about half of our faculty also trained here, and I was really impressed by the fact that so many people that had done their training here wanted to come back and be a part of not only this community but training the next generation of surgeons here.
And I think with everyone coming back here and knowing each other, it really creates a great sense of family. So in a lot of ways it's like a home away from home in training, which is something that you want. You want to have residents that you can depend on, as well as other faculty members and other staff members.
Yeah, it's kind of our culture as a group, as residents. We all get along. We all do stuff outside of the hospital together too, which is different from a lot of experiences that I had at other hospitals.
Originally from Eastern Ohio, I'm happy to call Youngstown home. This would be echoed by many in the department who have returned home to raise their families here. Physicians are very respected in the Mahoning Valley, and it remains an honor to serve the patients here. This is a wonderful place to train.
Well, hello, everyone. My name is Kathleen Harley. I'm the president here at St. Elizabeth Youngstown. And today I'm going to be with you as we go through more of your virtual journey, specifically looking at the residency living quarters. What I am so interested and happy to let you know is we have now a revamped 18-room residency quarters. Within those quarters, you will find a great dining room, common area, computer lab, and just an overall comfortable place to be. We have focused on this because we know how important your clinical competency is, but we also know you have downtime that's needed, and we want that downtime to be able to be productive. This is our commitment as administrators to our GME program. We are so thankful for the great program that our faculty and our associates have put forth, and this is our way to give back to that same commitment they're committed to every day to give you a great experience.
Again, my name is Heath Dory. I'm the program director. I have an open door policy. If you have any questions, comments, or would like to speak with one of our faculty or residents, please contact us. We're glad you got to spend a few moments with us. You got to meet some of our faculty and our residents. And again, we have a lot to offer from a training standpoint. This is a wonderful community and a great place to learn. And we hope you'll consider us here in Youngstown.